Yes, welcome everyone. This is our first lecture on introduction to healthcare marketing. Marketing is an important task in any business, but it's quite unique in the healthcare setting. And in this session, we are going to look at the evolution of this concept of marketing healthcare services. And then we will conclude by looking at the implication of the kind of healthcare services and products that we have in the healthcare industry. So marketing helps us to identify, anticipate, and also satisfy the needs of our clients. So therefore, when the clients come to us for any services, we should deliver value, okay? And in delivering this value, we must have actually created it. We create the value within the healthcare facility and then communicate about it and be able to deliver it, okay? So those are aspects to do with marketing, and they will help us to attract more and more patients. It will increase the brand awareness, and also, of course, as more clients are coming to the health facility, then revenues will increase. So, healthcare marketing actually has its origins. Its origins can be actually traced to marketing in general, and marketing is relatively a new field, and it has also had its own path. And this path can be placed into four stages: the production era, the sales era, marketing era, and the relationship era. So we are going to look at each of these. So during the Industrial Revolution, major businesses concentrated more on producing more and more goods with few resources. So you get more output out of the input, that is efficiency. So the emphasis was on producing products with the highest level of efficiency and also distributing them to where the consumers can get these goods from. So basically, during this era, the emphasis was on delivering the product such that the needs of the clients are met. Okay, so it was only about production processes and lowering the costs of input. Okay, and marketing was not something very big at that moment because people actually needed the products, and so it was more on let us produce more, mass production and economies of scale. And then the next era is the era that we are calling the sales era, which started in early the 20th century to mid 20th century. This era emerged out of competition that started to emerge and the need for these organizations to offer something that actually differentiates them amongst the many companies. Okay, so there was a change from being product centric to more of being consumer centric. This is to say that there was a transition to focus more on what the consumer needs in order for them to purchase the product. Okay, so it was a transition which saw a lot of persuasion and promotional efforts such that we have more products being sold. And then now we move to the marketing era, which began around the mid 20th century to the late 20th century. This one also saw a transition in marketing philosophy and emphasizing more on the consumer or the customer needs and wants. So this is where now organizations started to make or to deliberately make comprehensive marketing strategies. And this is where we see things like market research, segmentation, targeting, positioning. All these occurred during this era. The emphasis of these processes were basically to identify and satisfy customer demands more effectively than what other competitors could be delivering. So this was the transition where organizations were now having long-term marketing strategies, building reputable brands, creating value for customers through product development and effective communication. The current era that we are in at the moment is what you can term as the relationship era. This era focuses more on recognizing that relationships between organizations and customers are actually very, very important. So the more you build customer relations, and the more you become prominent in the minds of the customers. Okay, so this actually is a reaction to of the stiff competition that has always been increasing over the years. And therefore, the emphasis here is that you want to keep the customers that you already have. So you want to have a system which maintains the customers, loyalty programs, personalized communication. These are things that are actually very important in the current market. And now with the use of digital technologies and social media, these relationship maintenance strategies have actually gone to that extent, that allows organizations to directly interact with their customers through these technologies, and these enable them to get what we call personalized experiences and online presence, which enable ongoing engagement. Healthcare marketing over the years has not really been so different from what we have just seen while looking at marketing in general. But healthcare marketing has been lagging a little bit. Okay, it has been lagging. It has not developed at the same pace as marketing in general. And we shall look at the reasons as to why. But basically, in the 1950s and 1960s, healthcare organizations actually did not focus a lot on marketing. So it was really minimal. But they could use traditional marketing strategies such as print advertising, brochures, direct emailing to promote different healthcare organizations, maybe the hospitals, clinics, and pharmaceutical products. In the 1970s to 1980s, of course, now competition also became stiff, and therefore this needed more in terms of expansion and specialization, such that the organizations could actually be very visible. So therefore, marketing, healthcare marketing became uh, prominent, okay, started to become prominent, and organizations actually implementing more complicated marketing strategies or sophisticated strategies, including the use of community outreach programs, advertising on billboards, radios, and television. Okay, and then in the 1990s to the early 2000s, the focus now came on the focus was now on the consumer. Okay, the focus now became more on the consumer, and that the consumer actually became the center uh, of uh, uh, of marketing. Okay, so this actually implies that the healthcare organization targeted consumers directly, emphasizing the fact that when the consumers come to the healthcare facility, they should be satisfied about the quality of care. They should be able to give their opinions on the quality of care, and they should receive care in the most convenient way. Okay, so this also is because of the rise in competition that allowed healthcare organizations to make sure that they actually stand out of the, the rest. And then the other transformation that happened that we are actually experiencing now, starting from the early 2010s to 2020s, the focus now is on using digital technologies uh, to communicate and influence consumers' behavior. The emphasis here is on making sure that healthcare organizations are available on digital platforms, social media platforms, search engines, and also hospitals are now creating mobile apps to engage with patients and also build their brand. Still, the emphasis is on patient centered care, and therefore the marketing strategies rely a lot on patient centric marketing strategies. So, marketing in healthcare, like I earlier on said, did not pick up as a discipline earlier on. So, this is basically because there were some factors that were responsible for this reluctance to market healthcare services. Healthcare is a field that actually has its own unique traditions and cultural norms that make it very difficult for people to adopt the commercial marketing strategies. Okay, and then the other factor is also that marketing healthcare services actually poses ethical issues. Okay, there are a lot of ethical issues that can arise because of marketing. So the strategies uh, should be in a such a way that they do not compromise patient welfare, privacy, or even result into issues of trust. And then health professionals are individuals who have their own professional autonomy, and they are not usually very okay with marketing efforts because this is usually perceived as commercializing their work, and this is not something that they can always take lightly. Um, many stakeholders in the healthcare industry may actually be very skeptical of marketing efforts. So they will not really devote a lot of resources to marketing because they look at marketing as self-serving and perhaps as a way that lacks transparency and may result into negative consequences. because many hospitals or many healthcare organizations don't want to be looked at as entities that are focused a lot on commercial motives. So that's why people are very resistant to marketing healthcare services. Within the organizations, within the healthcare organizations themselves, the personnel could actually have issues ranging from internal conflicts, lack of alignments between departments, and reluctant to allocate resources for marketing. So this actually means that within healthcare organizations, there are people who are responsible for taking decisions, either to go full blown for marketing health services or not. But also the issues can emerge because of the complexity of the healthcare organizations. There are often many departments within a hospital. So which departments are you going to market? And the different heads of these departments may have different perspectives on healthcare marketing. So this usually creates internal issues as related to marketing healthcare services. Then, of course, these healthcare organizations may not want to pool resources for marketing. They could rather devote their resources in marketing new technologies or new approaches to handling certain diseases than to basically market the whole healthcare organization. Usually, the point here is that there are a lot of resource constraints, and therefore devoting resources for healthcare may be something that cannot be easily achieved. However, these days there's an increase in marketing of healthcare services. Okay, and partly it's because there is advancement in technology, and this technology is now allowing for interaction with consumers or clients. And therefore, when this interaction occurs, this means that you're actually advancing marketing. But the more we have a lot of players in the market, means the more we're going to have competition, and therefore it's very important that you actually stand out of this competition. And then the other issue is that the rise of consumerism, which is the fact that the focus is more on delivering effective healthcare, uh, care that meets the needs and the preferences of the consumers. The other thing is that healthcare industry is also moving towards uh, directions which allow for targeted marketing. You don't want to be marketing to everyone, but you want to tailor your marketing to specific demographics, to a given group of people. That's what you want. Okay, so since you have a particular niche or a particular group of people that you're targeting, you need to directly communicate with them and interact and engage. And therefore, this is why there is an increase in marketing. Um, but also, you can use marketing as a strategy of promoting preventive care services and wellness. Um, you couldn't want to be focused more on treatment as the form of care that you're actually delivering. That if you deliver more of preventive care and wellness, you're actually doing a public good. So as you're delivering or as you're marketing, and your marketing is focusing on preventive and promotive care, then it's a win-win situation. Okay, but also the other thing is that healthcare organizations also are interested in growing their brand and reputation, and this is very key. And these are actually tailored. Branding, reputation management, and marketing move hand in hand. and that's why the investment in marketing is also increasing. We have a lot of healthcare organizations, actually, this is because of the competition. So therefore, you need to basically stand out. Okay, you need to stand out and differentiate yourself from the rest. And that's why you need to actually invest. And then, of course, marketing healthcare services comes with some restrictions, but different countries have different levels of restrictions for marketing. And therefore, some countries have been more laxed than others in regulating marketing of healthcare services. So if we have room for marketing healthcare services entities, will go in for them. The other thing is that we now use data analytics to tailor our marketing strategies. We don't just market healthcare services. You need to use data to inform you. So you need to look at the patterns, the trends, using data such that you can formulate your marketing strategies. And then the other thing is that you want to focus more on the patient using patient-centered approaches. And this actually results into the need for marketing. So in summary, we can say that marketing is very important because it allows organizations to increase awareness and understanding of healthcare services being provided. The patients are being engaged, they are being educated and empowered such that they can actually make informed decisions. It also allows the public to access quality healthcare services for even populations that are underserved. It also promotes preventive care and early intervention to improve health outcomes. It fosters trust and credibility, and then also it facilitates two-way communication between the providers and the clients. Marketing is a driver for innovation and adoption of new technologies, and then it also allows healthcare organizations to attract the best healthcare professionals in the field. It will result in increase in revenue, and this is very important for sustainability of healthcare organizations. And then lastly, the more you have competition, the more likely that you have increase in quality. So the healthcare industry is actually quite unique. It's not like the other commercial industries. It is quite unique because there are a lot of stakeholders involved, a lot of rules and regulations, and a lot of processes. So it is actually more complex compared to other industries. In real practice, decision making usually littered with ethical issues that can usually arise. So ethical dilemmas are quite often, quite many in the healthcare industry. Like I said, the healthcare industry is highly regulated and requires compliance with the number of laws, standards, and also guidelines. And then the other thing is that it focuses a lot uh, on the patient. So this actually makes it unique. The other thing is that a lot of other things actually happen in healthcare. Things like medical research, development of drugs, and also issues to do with health crisis. Each of these actually pose unique challenges to do with regulation, to do with the ethical consideration, to do with the resource allocation. But basically, healthcare industry is a high-stake field because it involves matters that relate to life and death, and therefore it's not like any other industry. It requires a lot of collaboration amongst stakeholders, but also amongst other disciplines. and always the emphasis in healthcare is that there should be continuity of care. Um, so because healthcare industry is quite unique, it also means that the healthcare marketing is also unique. And some of the points that we have on this slide are actually issues that I have in one way or the other actually explained. But I will repeat. One is that the healthcare industry is very complex. It has a lot of stakeholders. It has a lot of target groups. Okay, if you have a hospital, your focus could be on the elderly patients, the middle-aged, the uh, the children, okay, or maternal issues. Okay, so if you're going to market these services, you need to tailor your marketing strategies to meet the target for which you actually set in the marketing plan. So that makes it actually very unique. So it has many categories of potential clients. And then the ethical issues need consideration in designing healthcare marketing. Need to take note of that, and also the regulatory compliance, which could be at the national or state level, is also very key. It is a high-stake matter. Marketing healthcare services is something that results into high-stake decisions. Okay, and therefore trust and also relying a lot on patient approaches is actually very key. Stakeholders, that's something that I've just explained, but healthcare generally has an impact on society. And therefore, that means that if you're designing marketing strategies, you need to be very thoughtful and tailor your message quite very well. The professionals working in the healthcare industry have what we call professional autonomy. They can make professional decisions, and these usually have influence on marketing acceptance. The information usually is very complex, and usually it needs